It is soon time.
Soon time.
Soon time.
Hello, it's time for us to do the thing.
All right.
Sorry.
Can't do that anymore.
Broadcasting live from the United States of America. You're listening to the Living Sexy Radio Network, playing the sexiest music on the planet.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212 or text 23680.
What are you asking me now?
I don't know.
Are we live on what?
Well,
yeah, we're live.
I didn't really.
Didn't feel it? You didn't feel it?
No, the electricity hadn't hit me.
Oh, it's right now. Feel it now? Ooh,
Oh,
the
there
whole
it is.
room is
There's
all
the buzz.
full. Woo! There it is. Okay, now we're in. Getting our chairs here. A little bit warm in the studio today, but it's cold outside.
I just
sort
couldn't
of.
feel the feed. Yeah, I mean, there it is.
There it is. Now you feel it? Got the beat? All right.
I'm feeling it.
All right, did everybody. Welcome to the show. Melissa Wolfman Fox, how are you?
There you go.
Oh. And of course, Dr. David Klein. This is Stages of Life Medical Institute's radio show. We call it Stages of Life Radio. And today, Dr. Klein says he wants to talk about pain, back pain.
Back
aches.
pain.
Yeah. What's pain? You
Well,
know?
yeah, there
so
we go.
elusive, that thing.
So, back pain. Okay, so what is it all about? Who cares? Is it real? Is it something that you necessarily need to worry about? What does it cost? What's it worth? What's the impact? And it gets interesting because nobody really cares how you feel when they ask you, hey, Mrs. Jones, how are you feeling today? The right answer is fine because nobody really wants to hear you whine. But backache is something that plagues about 6 to 8% of the adult population, somewhere around 20 million people. That's a lot of people in this country alone suffer from backache. The older you get, the more likely it is you're going to have this problem. It's more likely that you're going to get it if you pack a few extra pounds. And the more pounds you pack, the more likely you are to develop back pain. Mm-hmm. The heavier the labor that you do, and to some extent, the clumsier you are. So if you're accident prone, this is something that can happen. And it doesn't take much of an accident, doesn't take much of an impact, much of a problem to develop issues in your back, especially the further down you go. Now, why do you think this is? I want you to imagine for a second, just for a moment. Now, this is going to be a throwback, and most of our listeners are older. We have very few people under the age of, let's say, 30 that would identify with this. But back in the day, we had these things called telephone books. Remember those things? They weighed about 7-8 pounds each, big, thick things, and you would sit on them at dinner time if you were too little. If you were taking piano lessons, they fit very neatly on that piano bench to get you up to where you should be. Restaurants used to use them if they couldn't afford those little booster seats. But a telephone book, I want you to imagine for a second that you took that telephone book and you put it in the palm of your hand and you brought it back to your chest. You can walk around with that telephone book for a long time. But as soon as you take that telephone book and stick it out at arm's length, it takes a whole lot more energy to maintain your posture with that telephone book. Okay, this is something called leverage or moment arm in physics. The more weight that you pack and the further it is away from the fulcrum, the center of gravity, the more effect it tends to have. So where is the fulcrum? Where is the balance point, the tipping point in human anatomy? Okay, and the answer is actually different for men and women. For men, it's a little bit higher than for women. Women, it's at the hips, the widest part of the hip, the broadest part of the beam, if you're nautical, as I am, Captain. And yeah, so for men, it's a little closer to the waist. But the more weight that you bear up high, the more the moment arm or the torque is about the lower back. So when you're carrying a lot of weight on the north side, it tends to cause difficulty. The taller you are, the more likely you are to have backache, and this is the reason. So if you've got somebody that's 6'5", 6'6", it's far more likely that they will develop lumbar pain than somebody that's 5'2".
Really?
All
'Cause
things
I got a
being
4'10" person who had a ruptured lumbar disc, but it happened.
It happens.
From an auto accident.
An auto accident.
That
Now,
compression.
Well, we
I
haven't
suppose,
gotten
right?
there yet.
So
We're just
hold
taking
your horses, little one.
We're taking people just in general at first. Then we're going to get a little more specific.
Okay.
So, and we can talk about the types of impact that you can take and what the net effect is on certain parts of the body, and we can talk about that at length. But right now, what are the manifestations? What are the causes? What are the symptoms that you can have for different types of backache? And this is wickedly important because you are going to go into a doctor's office, okay, and you are a lamb waiting to be slaughtered much of the time, depending upon where you go. So, well, you've got low back pain. Does it hurt you down your leg? Okay, now, your leg is a long way. It goes from an unmentionable place all the way down to your toes. And it depends upon where you feel the symptoms as to what you're going to call it.
Right.
Depending upon who you go to, what their skill set is, and just exactly how honest, earnest, and forthright they are, you're going to get a good answer or you're going to get the wrong one. So a lot of people get operated on unnecessarily and probably maliciously, in my opinion. So back pain. So what are the places in the back that can actually get damaged? We're going to discuss ureters later. We're going to discuss the colon at some other time. We'll discuss the other retroperitoneal structures at a later date. But right now, we're going to talk about the skeletal structures of the spine. So fundamentally, what you have is something very much like a cinder block wall. Okay, so you have a block, then you've got some mortar, then you have another block, and then you got some mortar, and you have another block, and then you have some mortar. And then up through this situation, okay, you've got another mortar, block, and wall. So the spinal cord goes between two bits of bone. It's like an arch. It's a canal. The most posterior portion of this actually are the vertebral bodies and something called discs. They're spacers. They're lubricating pieces of apparatus. They're also very delicate and they can be damaged easily. Up front, which is where these things sit. They're very, very, very well protected. In back, they're supported by these things called facets, which are bony articulations from the top on down. So these are the sorts of things that move. They allow you to move this way and that. You can't twist as far as you might think because of limitations by the facets, but also the disc. If you twist too far, the disc can become damaged and fractured. Motor vehicle accidents are a great way to do this because you lose your ability to protect yourself from this type of trauma. So the different varieties, we're going to start with arthritis because that's the one that most people can identify with. Osteoporosis is one of my most favorite diseases because it's so predictable and yet so preventable. We can talk about neoplasm. We can talk about herniated disc. What does that mean? They happen in multiples. Then you can usually pick it up on x-ray or whatnot. But in the back, the place where you typically see arthritic changes are in the facets. So when you go to the doctor's office and they talk about, well, gee, you show spondylosis, these are little bone spicules that are impinging, maybe yes, maybe no, onto the nerve roots or onto the spine itself, the spinal cord. So arthritis of the facet joints is one of the most common causes of back pain. Why? Between these bones, and they have to extend and contract, very much like if you were going to take a hamburger bun, open it, and close it. I want you to imagine for a second, you have a burger, your favorite burger, your most favorite burger. It's looking at you. And you take the bun and you flip it up. You put another slather of ketchup on there. It's my wife's favorite condiment. You slather it with, she hates it. You slather it with ketchup and put it back down. Now, how would it work? Okay, if that were the disc and there were a piece of, let's say, cartilage or a piece of gristle in there, making it so that when you bring it back together, it would cause a pinch. That's kind of what happens with these little pieces of arthrosis. So they impinge upon that which is going between and betwixt. So things that make arthritis worse have a tendency to cause these sorts of back issues to get worse. So when you're carrying too much weight, when you eat the wrong things, and when you do the wrong things, this tends to get worse, and we'll pick this up right after these very most important announcements.
You got that down.
Oh, yeah, once in a while.
That's right. If you want to text in some questions, give us as much information as you feel Dr. Klein would need to help you out. The text line is 23680. And if you want to call and get online, 407-422-1212. For more information on anything Doc is talking about, you can go to stagesoflifemedicalinstitute.com. 616 on News Radio WFLA Orlando. Yay, I hope everybody's back there. Y'all back? Y'all back? So I got a weird text and it kicked us off the internet for 2 seconds.
Did it really?
Yeah, I tried to anyway, but it's all good. We're here and everything's fine. So, hey everybody, all of you that are watching out there, you got any questions? Linda, you back on there still?
What's our phone number? If people wanted to call in, what's our phone
I just
number?
gave it 407-422-1212.
1212. Okay, yeah. Eventually, I'll memorize that.
You don't have to, because eventually we'll be back in the main studios, probably, like I said, beginning of the year.
Good for. Okay, well, excellent. I have
Something to
to
look
find my
forward
way
to.
back there. I haven't been there in such a long time. I forgot what it looks like.
Stop now. Well, actually, it doesn't look anything like when you were there last.
Oh, is that right?
Oh, yeah. It's totally new.
The wires aren't hanging down from the ceiling.
Not anymore.
Ah, man, that was the
Nah,
coolest thing
It
going.
was pretty cool.
Yeah.
Oh, hello, OSHA.
It was like a horror movie,
It really was. I started dressing in construction clothing, so one, I would blend in.
and so you could get in after hours.
Right,
Yeah.
exactly, with no problem. It was neat because there was like no requirements. Anyway, fusion versus replacement. Hey, Mary Dees, how you doing? You're talking about that's a shoulder injury, I believe she's.
No,
referring-
well,
she's
could be,
talking
but
back,
I think
but-
she's talking back. And so what
Okay.
will happen?
Mary.
Should you fuse these joints? Okay, I hope that's what you're asking there, Mary. So, with lower back, even in the neck, yes, you can in fact replace the discs. There are some things that you can do to increase the spacing in there. It involves injection of liquid that hardens. There's some mechanical devices. You need to understand the problem with these mechanical devices and these injections, these almost like epoxies, is they're treated by the FDA as devices rather than drugs, which means that they don't have to go through the same process of study. So a lot of these things come and go because they just don't work like they say they're going to. They're wickedly expensive, and once you've had a piece of steel
Neck.
or something popped in there, it is yours forever. Now, with regards to fusion, okay, I can speak to that easily enough. My wife has had 6 neck surgeries for a broken neck, and she's fused from C2 down to C7.
45
Okay, so she has a hard time with it, but she's doing better now than she did. When you fuse things, what you're doing is you're taking those bricks, those cinder blocks, and you're placing a piece of rebar either in front or behind them to kind of tie them together so they can't move anymore. And when you reduce or minimize the amount of motion within the neck, the joints above and below seem to take up the slack, and that causes damage there. So you got to be very, very careful and understand what you're getting into when you fuse, especially in the neck.
Most all insurances are taken, the good ones anyway, at Stages of Life Medical Institute. He is local here in Longwood if you're listening in the Central Florida area. And he's also got a branch up there in Jacksonville.
And the laboratory, that's all diagnostic work.
Hey, welcome back. Yeah. Oh, you caught us talking. What does that mean? It means that we are live on the social media platforms, and during the radio commercial breaks, we do other things like answer questions for people who are on Facebook or Twitch or any of the
Periscope either.
Yeah, Twitter, YouTube, you name it. Anywho. Before the break, we were talking about back pain and the lower lumbars and
So
all that.
yeah, so what'll happen? And it's kind of an interesting thing, is that there are many different structures within the back that can be called pain generators. So back in the day, we would sit back and try to figure out what the pain generator was. This is called diagnostics. These days, you don't see it happen exactly the same way. Now, just to rewind 42 years, I opened the first office-based pain center in the United States, in Virginia. And so this was a time when pain centers were considered to be university, at university level. You would see them at major centers. There were 50 or so in the whole country, and I was supposed to stay on at Duke there. And they changed the deal at the last minute. I figured, well, gee, how nice if they're going to change it now, they'll change it worse later.
Why not?
So I hit the road. I figured I'd just do it myself. I didn't really need them anyway, and I was exactly correct. Whole lot happier in the end. But the first responsibility of any physician is to figure out what is wrong. And you would think that this would be hammered into the wall, but it isn't. That is among the least of their concerns. The first one is making you happy, or at least making you satisfied, or getting you out the door, all of which function the same way. But rarely do they sit back and take the effort to find out why. Why are you hurting? So there you are. So you've got a back that's been injured, and we'll get into motor vehicle stuff here very, very shortly. And so your back hurts. Well, I'll tell you what, very common complaint. It can come from any number of different things that may not even have anything to do with the back. You can have kidney stones and have pain in the back. You can have diverticulitis, have pain in the back, a dissecting aortic aneurysm. I picked up one of those on the radio, okay, when I was doing a show. So, what are the sorts of different things that you have to ask when somebody comes in with back pain? What do you know? You can have pain at your knee and it will cause back pain. Yeah. So you come in, 30% of patients, that's every adult that's at the mall, assuming the mall's open, which it hasn't been recently, 30% of the people walking around the mall have a herniated disc and don't know it. Now think about that for a second. 1/3 already have a herniated disc, but they're asymptomatic. Does that tell you something? Because it should. That means that a herniated disc may not have any pain attached to it at all or any symptoms at all, because that was the definition of what I just told you. Now, you take one of these unfortunate individuals that has a herniated disc and you ask them to lift up something and they pull a muscle.
Ow.
Now their back hurts. They have a pulled muscle. They go into the emergency room. They go into the surgery center. They go into the doctor's office. They get an MRI, and wouldn't you know, there's a herniated disc there. So the first thing that happens is they attribute causality to the radiological finding, which, by the way, is a freshman medical school error. Just because you have something on radiology doesn't mean it is causing the symptom. Just because you have a blood study abnormality or glitch doesn't mean it has anything to do with your underlying problem or the reason why you're in the office. So 1/3 of people have a herniated disc and don't know it, and yet, God help you if you pull a muscle or get a bursitis in the lower back. You extend the back the wrong way. Or let's say that you end up with a kidney stone. So be very, very aware that the first responsibility is to ask what is wrong and not what's on the x-ray. Gee, Dr. Klein, here are my x-rays, here are my MRIs, here's what's wrong. I think the reason why you're in my office is because wherever you came from, they went ahead and did something about that and it didn't fix it. That ought to tell you something. All day long, 5 days a week, sometimes 6 and sometimes 7 days a week for the past 42 years, I've heard the same story, and I have to come up with the same response, which is, I don't even really care about your damn x-rays. Let me talk to you and let me look at you. Well, I have sciatica. Oh, really? Does it hurt to your toes? No. Then you don't have sciatica. Okay, you want a herniated disc and then pinch the nerves in your lower back. If it doesn't go to your toes, it's not coming from the disc. I am so terribly sorry to tell you that. I have people that want to kill me for telling them that. But it happens to be the fact. So the first responsibility is to figure out what is wrong. That was the first slide in my sets when I used to travel and lecture a lot. I don't do it anymore. I'm happy to say that, actually, because I felt like I was falling on deaf ears. You have to know what you're dealing with. So with backache, back pain, you need to figure this thing out. Now, let's take some real life sorts of situations. So you've got somebody who's now in a motor vehicle accident. So they're cruising along and somebody hits them from behind, which, by the way, in Florida is a sign of friendship. It is a social greeting here. It happens so frequently, you would think that it was a desirable outcome. And so what happens is you take a 2-ton missile and slam it into your 2-ton missile, moving you only 4 or 5 feet, okay? But all of the energy that was in the car behind you is now delivered to yours. And so what happens is anything that's nailed down hard does just fine, but it's the movable pieces that cause problems. So there you are. You're sitting there in the driver's seat. You're sitting in the passenger seat. If you're from West Virginia, you're in the back of the pickup truck, and you then become a secondary missile. So not too many decades ago, they increased the height of the seats of the cars, and the reason was that your head would become just an absolutely awesome secondary missile. So if it didn't have support from behind, your head would be thrown backwards, which would then damage the facets, damage the ligamentous structures, and damage the discs themselves. Extension is a killer for the disc. Yeah. So now we have headrest. You can't buy a car that doesn't have an adequate headrest. So you're struck from behind, you're pushed back in your chair, and now instead of it being thrown backwards that causes the problem, we used to call it whiplash. We don't see that anymore. Now it's being thrust forward. So the ligaments are then torn. So this is the basis of many, many problems. The ligaments are torn. So you can have a broken neck without breaking bone. You can tear the ligaments and become unstable. Happens to folks with rheumatoid arthritis, actually. Something you need to be aware of if you have RA. So what are the sorts of things that happen at this point? Now, usually you feel okay for a day or so. Well, Mrs. Jones, would you like to go to the emergency room? That's like playing Monopoly. Do you want to pass go? Or, it's just the way these things go. And so it's a good idea to get checked out. However, the pain doesn't usually occur until the next day or the day after that because things have a chance to, they have to swell. Now, what is it about the discs? Okay, I'm going to focus on this because we have a question from one of our loyal listeners about a ruptured lumbar disc. What a ruptured disc means is that the gelatinous junk on the inside of the disc, which gives it its flexibility, breaks through these annular, that means ring-like fibers, okay, and ends up in the wrong place. Now, you can rupture a disc anteriorly, posterior, laterally, anterolaterally, so it can either hit nothing or it can hit into the nerve roots. So it makes a difference as to what's going on. But the pain may be very, very different. It may not come from the nerve root at all. So I'm going to give you an onion. I'm going to ask you to cut it in half. And I want you to look at the onion. You see these onion rings. That's what the annular fibers look like. So if you crack them, the stuff on the inside of the onion squeezes its way outward. That process takes time. So you can bust a disc and really not have severe impingement syndromes for weeks, months in some cases. So that is sort of an interesting process. But in the meantime, you crack it. It starts to swell. It starts to become what we lovingly call edematous. The cellular liquids tend to extrude outward. And then because there's no place for them to go, it becomes inflamed. So it's terribly, terribly important that when you're injured acutely, that you do something about the anticipated inflammation before it becomes a problem. And this is where the doctors in the emergency room tend to fall down a bit. They're not going to give you what you need because they don't know enough about you, and they're moving on to people with things like heart attacks and stroke. So, so Linda, with regards to your ruptured disc, what will happen is that you'll either be hit, part of you're moving, but the car did not move, and if you rotated, you'll end up with annular tears. If you're thrown backwards, which is unlikely if you're sitting properly in your seat, thrown forward, what will happen is you will then end up with compression fractures. These are the sorts of things that can cause misery. So, okay, we have somebody that just wrote in a cool one. Okay, I have severe spinal stenosis per test. Okay, which I don't like. Okay, I guess
that's you.
Yeah, there we go. And I've been waiting for a corrective procedure for 7 months. Thanks to the VA. Okay, so the story with corrective surgery for spinal stenosis, what you do is you go in and do a laminectomy. All right, you go ahead and you provide space for the spinal cord if, in fact, it's being squeezed. So stenosis means narrowing.
Okay.
Narrowing of an artery, arterial stenosis. In the spinal stenosis, we'll pick up in just a moment. And I was a VA doc for 4 years. Okay, and so, yeah, and they operate with, let's just say with a very, very different drumbeat.
All right, this is Stages of Life Radio live on Sunday afternoons from 4 to 5 right here on News Radio WFLA Orlando. Podcasts are available off of the iHeartRadio app, and then Stages of Life Medical Institute.com has everything else that you could possibly want for when it comes to the practice,
lots of stuff.
I mean, there's just so much. So stay tuned. We'll be right back. But there we go. All right, so what's even going to do?
So
Doctor explained it as the jelly coming out of a donut.
That's exactly it.
Yep.
Yeah, jelly out of a donut implies. That's actually not a bad way to do it.
That is a good analogy.
Yeah,
really.
and it works. That was how it was explained to me too. Okay, but really, it looks a whole lot more like an onion than it does a jelly donut.
Well, because of the tribal
well, for starters,
rings,
you only have a dollop.
Yeah, nowadays
of goo on the inside.
Chase it down.
Yeah. So if you were cutting into an onion and you scooped out with a tablespoon the inner portion of the onion, that would be more the way these things operate.
Yeah.
So the annular fibers that get broken are really, really tough. Mm-hmm. Okay, these are ligaments that go around in a circle. It's kind of neat. Okay, whereas a jelly donut implies that really it's just a whole lot more delicate.
Now I'm hungry.
Now you're hungry. Got it. Now, so Okay, so Linda got T-boned. Okay, which we're not talking about going to a steak restaurant. So she was
fun
struck
as
from
it
the
sounds.
side. Okay, so there's not a tremendous amount of protection for your neck and lower back when you're hit from the side. So you've got your lap belt on, your shoulder harness. You get struck. Okay, your body is going to flex in a way that it's not supposed to flex. Now the thing about Linda is she's a girl.
Oh.
Girls have something that are going for them in certain ways
Boobies.
and against in others. Boobies being it. So that weight, which is actually north of your waist, okay, is going to act like a pendulum, and you know what I'm talking about. It works for you and it works against you. So now your weight is going to be centered very, very different. So you're going to end up flexing a little closer to your rib cage, and this is going to cause terrible stress around the lower back. It doesn't take much of an impact to do it.
Minute and change.
It's sort of an interesting thing. You can die just by rolling out of bed, break your neck.
Oh, yeah.
One
No,
of my
94-year-old grandma did this exactly
my
that.
classmate in medical school rolled out of bed, broke his neck.
Ouch.
Okay, that's and so he went around in freshman year with his in a Philadelphia collar, and it was
Yeah.
it's kind of an interesting.
When we
thing.
come back, after we finish with the spinal stenosis, we've got a couple of questions about, a couple off topic. And Mary Dees, who was talking about her neck, but the shoulder, I think, is attributing to the problem.
It's like anything else. A lot of things will contribute to pain complaints.
Mm-hmm.
So if you don't get a good night's rest, I don't care what your complaint
right out
is,
of the
it
gate,
gets
yeah,
worse.
yeah.
Shoulder is an interesting thing. I've had a rotator cuff tear since I guess I was 21 years
I
old.
had orthoscopic surgery.
Oh,
on
I
my-
won't go in. I'm too big a sissy.
And then once they got in, they were like, "Oh, looks like you had a defect from the get." I'm like,
No.
"Yeah, no."
Yeah.
Let me see those microscopic pictures. Nope, that's not what that is. So stay tuned. For those of you listening on, Mary Dees, hang on. We'll get you in the next break if we don't get to it during the segment here. Welcome back. It's Stages of Life Radio, Sunday afternoons 4 to 5, because sometimes football stinks.
Yeah, there you go.
Yeah, I mean, it's true. It's only. But really, this right here with Dr. David Klein, this is where you get the right information about everything that you need to know, and some stuff you didn't really need to know, but now you're like, what?
Yeah, and we don't kneel at the national anthem.
No, we do
We
not.
stand up.
Take your
as
hat
you're
off.
supposed to. Yeah.
Put your,
All right.
well, I salute you.
Well,
You
I do
salute
that
as
line,
well.
yeah.
Yes. yes.
That's what
Anyway,
you're supposed to do.
so we have a lot of questions lined up here. We've been talking about back pain, what causes it, and such, and
And the head fakes is what we're going to talk about now.
Yeah.
Okay, so we've got a lady up there that's discussing the fact that she's got some discs in her neck that are damaged and a shoulder problem.
Mm-hmm.
Okay, now here's the funny thing about that combination. Okay, it's only funny if it's somebody else.
Oh, yeah.
Does one thing make the other worse? Now, go to your anatomy textbook if you have one there, Mary. Okay, if you don't, then go on internet, which I've been having a challenge at my home, and look for a muscle called the levator scapulae. Now, the levator scapulae goes from the shoulder blade to the neck, C3, 4, and 5. And what it does is it tugs on a lever pulling those particular vertebrae every time you move your shoulder. So shoulder issues will make neck issues worse every time. And you have to be very, very careful, because you can't really fix one without considering the other. If you go ahead and you take care of your neck without dealing with the shoulder, or shoulder first, you're not going to be particularly happy about it, because every time you go to move your shoulder, that muscle is going to tug right on those three areas. So repairing the shoulder first is probably your best bet. The orthopedic surgeons will probably change. They'll have a different
She's
opinion,
saying
but I
there's
don't really
two
care.
different doctors, two different procedures recommended. One said fuse 2 discs, the other said replace 2. Both said I have 3 that are damaged, and the pain is miserable. She's been dealing with this for a couple of years now. I've been following along with her pain, cheering her on.
Well, it'd be kind of an interesting sort of thing to find out really what the pain generators are.
Right.
Now, one of the things that the docs love to do, okay, and I was hoping to discuss this a little bit later, but I'm going to do it right now, because if I don't, I'll forget to do it, I think. And that's epidural steroid injections. And here's the way that these go. I've done over 15,000 of these. In the neck, I was the sixth in the United States to do cervical epidural steroids. I don't know if there's anybody around here that really does them, and it's just as well that they don't. When these things are referred out by the orthopods and the neurosurgeons, typically they do is well, go get 3 epidurals, and then when they don't work, come back and we'll do surgery. This ought to tell you what the value is. Why did I stop doing them? And the answer is because they don't work.
Fair enough.
Epidural steroid injections are useful if you have discitis and no other reason. Certainly not spinal stenosis, and most assuredly not a herniated disc. You can get every bit the same effect out of the steroids by taking them orally if that were in your best interest. But by giving people these epidural steroid injections, particularly when they're done over and over and over again, is that it suppresses the adrenal glands, which kick out your body's natural anti-inflammatory hormones. And these same gentlemen and gentlewomen do not check their lab work to see that they're doing damage and correct it before it becomes a much bigger problem. So when you have 2 doctors, you're going to get 2 opinions. When you have 3 doctors, you may get 5 opinions.
True.
Now, there's probably nobody listening right now that doesn't have multiple damaged discs. So to say that you have 3 damaged in your neck doesn't necessarily mean it's necessarily actionable. You have to figure out what's causing the pain. And so I have patients that come in all the time with herniated discs. They come in post-laminectomy. 1, what does that do? 30% likelihood you're going to end up with post-laminectomy. 2, then 3. And they come in, gee, doc, we need to do something about pain control, which to everybody else means giving them pain meds. And you find out they have a tendonitis in their hip. Okay? I'm not kidding. You inject the hip, the pain goes away. What does that tell you about the necessity for the surgeries? Number 1, 2, or number 3? A lot of what happens is things are done without consideration for the entire patient. So what do you do, Mary? Okay, if you have osteoporosis, do you go ahead and let them fuse you? Okay, this is what happened to somebody very near and dear to me. She went in, she had a surgery, had a fusion. The little screws, the little plates didn't hold because she had osteoporosis, really osteopenia at the time, I imagine. So they did surgery number 2 and then surgery number 3, replacing these little screws and plates because they wouldn't hold into wet drywall, sometimes known as osteoporosis.
Gypsum.
So what do? Do you go ahead and rebuild the whole neck, or do you harden the bone? So one of the first things you want to do, especially females more so than men, and if you have a little age on you, more so than if you're a bit younger, and that's to harden the bone. And I'm not talking about using Fosamax or some of these other fancy bisphonates, because what do? They actually don't harden the bone at all. They slow down the progression of osteoporosis, but they do nothing to reverse it. They can do a lot of damage. So, what do I think? I would get another opinion to find out really what is going on. And, to say that you have 3 discs and that's causing all your issues, I can reproduce disc pain by putting pressure over the C5 dorsal root right at the tip of your shoulder blade. You would think you had a herniated disc. I can do it with my fingers. It's just kind of like one of these Spock moves.
You come over here and even prove it to anybody on the radio, I will knock you away.
No, but in the same thing is true.
He was looking at me. I had that little glint in your eye.
There are lots of these things that will cause
Come here, give me your knee.
These mimics. So you got to be very, very careful. Just because you have a radiological finding doesn't mean it's causing the symptom that you're focusing on. Okay. You have to do this. Even So Mary had 4 sets of injections. Typical.
Oh yeah.
Okay, that is just typical.
Just keep putting some steroid up
just
in
keep,
here
keep
or whatever
doing
it is.
Keep shutting down the adrenals, keep shutting down your cortisol level, and keep getting worse. Yeah. And that's kind of what happens.
Meanwhile, that stuff is really, like you said, it's really affecting your organs and such too, because it's just not healthy.
It's interesting. So severe spinal stenosis, getting back up to the VA patient. Okay, first thing that you need to do is lose weight. Okay, that is the hardest thing in the world for anybody to tell you, but it is exactly what you need to do.
Okay.
So you've got to lose weight. Why? Because what caused the spinal stenosis, more than likely, it was arthritis due to improper weight bearing, which happens when you're overweight, as I am right now. I've got to lose another 30 pounds again. Why? Because I got, what happened was I had to lose weight when I was going through the divorce, because otherwise I'd never date. And so I got down to my high school weight.
Right,
and then, just like it is for everybody else, you get into complacency. And now, don't you know, I ate half a pound of these chocolate-covered almonds. And those of you that are patients of mine understand my disdain for that type of stuff. But I, too, can fall victim.
Everything in moderation.
It happens. So, question: is niacin a good substitute for the statins? I can give you a long list of things that are substitutes for statins. Niacin not being one of the better ones. Niacin can cause a rash. So niacin is good stuff, but you have to be careful with it. It doesn't really, it will help lower cholesterol, but there are much better ways to do it. The most interesting one is to look for thyroid disease. Now we have another listener who's talking about temperature being a little out of whack, and this is a perfect time to scroll up and get to that. So this individual, was looking at temperature. I don't know if it's a male or female, don't know the duration, but it says, when I take my temperature first thing in the morning, it's always 2 degrees below normal. Patients of mine would immediately smile and go, you have thyroid disease. Okay, why? Now, 2 degrees below normal in the morning means your temperature is 97.2, 97.1. There are days when you're going to be looking at 96 and change. That's only normal for a turtle. So why would you have a low temperature like that? Hypothyroidism does it. And when you're 2 degrees below normal, it's almost always autoimmune. Almost always autoimmune. So it's Hashimoto's or something similar. Your temperature does vary as the day goes on. It hits a low of 97.6 at 4 a.m. It hits a high of 99.6 around 10 p.m. If you tell me, well, gee, it never gets to 99 or I never get fevers, you have hypothyroidism.
Yep.
What is the blood study that's most likely to show in somebody that's hypothyroid? Any doctors out there? Because the answer is, guess what? It's going to be cholesterol. Yay. So cholesterol goes up when thyroid function goes down. So wouldn't you know it? We're able to get people's cholesterols down into the 160s, 180s, or lower, which I don't think is necessarily good, by using thyroid hormone. It's fascinating how this stuff works. You replace the piece that's missing or you fix the problem that's there, in spite of the complaint, which might be something very different, and then the body gets better. It's the darndest thing. So temperature low, thyroid. Now, are there other things that can lower temperature like that? And the answer is yeah. You can have hypothalamic issues. You can have adrenal issues. Okay, so when you treat thyroid, you better look at the adrenals also, because the two glands tend to run in tandem. That means they run in the same direction. So if you have low thyroid function, it's extraordinarily common to have questionable or marginal adrenal function. Now, in all fairness, adrenal function is not something that's taught very much in medical school, like none when I went through. Really? We identified the glands, we knew what they produced, we talked a little bit about them and then moved on. You learned about what the different cancers were, the different tumors were, and after that, you didn't pay any attention to them. They're probably the single most important pieces of tissue you have in your entire body.
Yeah. They are. The adrenals, it is. That's pretty cool.
The adrenal glands get more blood flow per gram than any tissue in the body, including your brain and your heart. Not by mistake there, guys.
All right, look, we got one more segment left. We got a bunch of questions lining up here. Let's see if we got anyone on the phones at 407-422-1212. And 23680 is the text line. It's exactly what the VA told me.
Yeah.
Well, there you go. Stay tuned. We'll be right back. How about that?
Yeah, well.
Okay, let's see. We got another one up here. You already answered that one. This is about the weight loss.
Okay.
There it is. What have you heard about this weight loss injection for people that don't want the bypass operation?
Okay. All right. I want you to understand about weight loss and weight gain. And to some extent, okay, it's a lot like astronomy. Okay, big planets keep getting bigger because of their gravitational field. Mm-hmm. Big people keep getting bigger because the fat tissue actually is endocrinologically active, creating hormones like ghrelin, which will make you gain weight. So the more weight that you have, the more you tend to gain. So you can go ahead and you can do surgery. You can do bypass surgery, and it typically knocks weight off for a period of time, and then you blossom out all over again because it did nothing about the underlying endocrinological issue. So the best way that you can deal with this is to reset. First thing is you find those pieces that are wrong, and you bring them back into balance. Again, thyroid being number 1, adrenals being number 2. Hypothalamus being number 3. How do you influence the hypothalamus? This is another one that's just so easy to do, yet so few people actually pull it off. And that's sleep properly. Now, I want you to go to the National Library of Medicine, PubMed, PubMed.gov. It's going to pop up. You paid for it with your taxes, or if you evaded taxes, you didn't pay for it. And you go to the search bar, and you type in melatonin, a space, a plus sign, and then write sleep weight loss. Melatonin can be considered a weight loss medicine. By getting people to sleep, they lose weight. Look up melatonin the same way, melatonin space plus diabetes. It will reduce your dependence on insulin. It'll actually prevent or treat diabetes in many people. So getting your hypothalamus back into a normal sleep cycle. How do you do that? Number one, okay, and I'll hand this one to my old lady, my wife.
Oh.
Okay. Why? Because she's the one that reminded me and actually pulled it off, and she was quite correct. One of the rare times when she will hear me ever admit to this. And that's by lowering the temperature in your bedroom. You will sleep better. Now you're going to go, well, but then I'll pull the blankets over my head. It doesn't matter. You are breathing in the cooler air. That will reset your hypothalamus. So you want the temperature to be 71, no higher. The second thing is blue light. Influences something called the pineal gland and influences sleep cycles. So don't use your phone, your iPad, your television, anything that has blue light in your bedroom. If you have those little Alexa things, screens, cover them up. I use X-ray film. You can use something else.
Just turn my phone up.
Yeah, here we would probably use stuff they use in theaters. You've got theater gels.
Yeah, I do. You're right.
Yeah, they're cool.
They are cool.
Theater gels.
Welcome back. We're talking about theater gels here on Stages.
What else?
What else? Yeah, no, actually, we were just talking about a few different things, and sleep being very important, especially when it comes to weight loss. Yeah. But right now, it's time to get back to the text line and some other stuff going on here. It is Stages of Life Radio with Dr. David Klein. If you hear anything that interests you, or maybe you want to purchase something or become a new patient, just go to stagesoflifemedicalinstitute.com.
Just as a point of information, can you even get theater gels anymore?
I think maybe, yeah, probably pretty expensive.
Yeah, I mean, it's kind of interesting because now everything is LED. You don't need theater gels anymore.
No, there are some that, if you go back old school that you could find, theater gels and stuff. Here's one off topic. I'm on blood thinners after my heart attack, but the doctor changed them from Plavix to Pressargil because Plavix wasn't working. With the new meds, I'm still not bleeding any more than I did normally. What is causing that?
Don't know. Okay, it's kind of an interesting thing. So you've had a heart attack. They're going to give you something to thin your blood a little bit, make it less sticky. It doesn't necessarily mean that you're going to bleed more or longer.
Oh.
So the way I like to handle these things would have been to stick with the Plavix and then just add some fish oil and a small aspirin. And that will do it. Now, there are going to be people out there, but you could bleed too much. Which is worse here? Okay, going ahead and giving you an $800 a month biological. I'll give you Plavix, which isn't cheap either. Okay, or to go ahead and add a tenth of a cent worth of children's aspirin and some fish oil, which, by the way, is part of the food that you eat anyway. I hardly think it's going to do any damage. But that would be the way I would go with it. Now, while you're on the heart attack issue, high-dose folic acid has helped with regards to reversing the plaquing of the artery. So what you take is 5,000 micrograms of folic acid. It works beautifully for this. We have a product called Hyperfolate, which is just one capsule that does it. Or you can buy the 400s, just take a handful of them. But that would be something worth doing.
She's taking 85 milligrams aspirin a day.
That's it. It's 82 is what you're really taking. That's okay.
Tanya had a question here. Back to the back pain. She was told she had a compression fracture.
There we go.
T8.
Yes.
But she said, I'm getting rib and muscle spasms across my back.
What a shock.
Yeah.
Okay.
Spine doesn't hurt, but when I press on the spine, but I've got horrible pain at the low and mid back.
Harden the bone. Yeah. Okay. How do you harden the bone? T8, very, very common place to end up with a compression fracture. T10, T11 is actually a little more common. And the way I do it is using a combination of vitamin D3, that's 5,000 IUs, vitamin K2, between 150 and 200 micrograms, and then magical substance called strontium. Now, when you're using chelated strontium, it will harden the bone like rebar does to the sidewalks that you walk on every day. When you pour concrete over rebar, you end up with something called reinforced concrete. Yeah. It is much, much stronger. So what was it that allowed us to build skyscrapers in New York City and elsewhere? They had plenty of concrete. Since the days of the Colosseum, we had concrete. That's a concrete structure, right? Okay, Coliseum concrete, why can't it really go much above 40 feet, 50 feet? Because it starts to crush on itself unless you do something magical, and it's called rebar. You put steel in it, and all of a sudden you can go up 1,000 feet.
Yep.
Pretty neat. Now, what is the rebar to your bone? And it's called strontium. It is a naturally occurring element. Okay, it's there. You're supposed to get it in the groundwater, but wouldn't you know it? Here in Florida, we get groundwater out of a sand aquifer. It doesn't have any minerals in it. So you have to take it exogenously. That means as a supplement. Is it expensive? The answer is no. In Europe, it's a prescription item. It works in Europe as long as it's $300 a month. Here, because it's not expensive enough, your doctor won't talk to you about it. I will. It is cheap. It's about $30 a month for most people. What's the next question?
This one's actually on the same topic, asking you if studies have shown that
The
strontium
answer is yeah.
is more effective for osteopenia
Well,
than
for calcium is okay. Think
than
about it for a second.
calcium, yeah.
Think. Okay, you eat better now than you did when you were a teenager. You're eating healthier, and yet you're diminishing. Okay, so you got plenty of calcium in your food. So you think giving you more is going to necessarily help? What you're not getting is the strontium. So if you want to take calcium, knock yourself out. What I do is, as I mentioned above, you have to have an estradiol level measured, and it should be at least 25 to 35 range, and then the bone will harden. It takes about 6 weeks to 6 months before you can measure it, but it does work. So calcium, I tell people, if you want to take calcium hydroxyapatite. That's actually your most effective of all the calciums. How much do you need to take? 500 to 1,500 milligrams a day. Is it necessary? I tell my patients no, because as long as you're eating properly, you get plenty of calcium, but you're just not getting the strontium.
Okay, so this question is about low-dose aspirin.
Should you take it?
Should you take it?
Tremendous argument right now with the cardiologists.
Yeah, I've heard that. They're saying
yeah,
stop.
because
What's
a
it
study
do?
came out and said, well, gee, it
One
doesn't seem to
study.
help as much. Okay, there are thousands of studies that have come out looking at it, and it was perfectly safe and perfectly happy. You end up with one person coming out going, well, gee, I'm not so sure, and then everybody goes nuts. There was one study that showed that fish oil wasn't, couldn't raise omega-3 levels in the blood. That's not even what it's supposed to do. And it was done with the VA patients. And by the way, not to offend my VA listener there, but VA patients are not the typical people that are out there. So, getting, a compliant VA patient, that means, are you doing what you're told? Good luck. Okay. Yeah. That was one of the most frustrating things I ever had. Well, I was a VA doc. I was in the military 12 years, but the long and short of it is quite frankly, that is not a place to do population studies. So what was the answer? Oh, you need to take a $300 a month esterified fish oil. It made no sense. Didn't make any sense now.
All right, so who should be taking low-dose aspirin?
Who should be? Anybody over the age of 30. 82 milligrams of aspirin, you take it at night. It works best if you take it at night.
And Tanya wants to know, with regards to the T8 strontium pain management, how much on a daily basis?
Of the strontium? Okay, strontium citrate. Okay, you're looking at taking 200 milligrams, and this is where it gets interesting because the bottles will not necessarily tell you how much strontium is in there, but they're all very much the same. It's strontium citrate, and you'll be taking 3 capsules a day.
Okay.
So what does that mean? It means if you're 50 to 60, all you need 2. If you're 60 or older, you need to take 3. Breakfast, dinner, bedtime, breakfast, lunch, dinner works out just fine. I wrote some stuff 20-some years ago about this and suggested that you take the strontium separately from the calcium. I'm the guy that did that. It was wrong. It doesn't really make any difference. So, yeah. And so if you measure the strontium citrate, it's actually 750 milligrams, but it's only 200 of the elemental strontium. So just take 3 capsules. You'll be good.
There you go. All right, then. And that's pretty much going to put a wrap on today's show. I just thought I'd let you know that. It's coming around. I feel it. It's like right there. See?
That was close.
That was pretty
That
darn
is a
close.
touch. That is a touch landing.
Wow.
They-
That's
they-
right.
The passengers should be clapping right now.
They should be. Please do not deplane
Don't try
until
this at
we
home.
come all the way to a complete stop.
Please do not beat on the stewardess.
You're right. Don't hit the stewardess. Hang on to your nuts if you have not. What?
Yeah, there you go.
All right, we're out of here. Dr.
there.
Klein, thank you so much. The information's coming in just a second here on how you can become a patient, or you can find vitamins and all the other nutraceuticals, etc., etc.
Or send me fan mail. You never know.
Say bye.
Bye.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts many insurances and Medicare too. Join us next Sunday at 4 p.m. on News Radio